Hello and welcome to Absolute Trust Talk. This is our live coronavirus version of our podcast. I'm Kirsten Howe with Absolute Trust Counsel, and thank you for joining me today. Today we're going to do something a little bit different, but a little bit the same. We are live, which is starting to be the same and a little bit different. But today, for the first time in our live broadcast, I'm going to have a guest, which is the typical format for the podcast. Those of you who listen to my podcast know that the format typically involves me talking to a guest. And that's what we're going to do today, because I think you must be getting really tired of just listening and watching me. My guest today is Nicole Howell, who is the Executive Director of Ombudsman Services of Contra Costa, Solano, and Alameda. And we are going to be talking about, in this coronavirus environment, what's been happening in the long-term care facilities. Just as a little bit of background, the Ombudsman's Office is a federally mandated program. The states are required to provide ombudsman programs. Their job is to oversee, to work with, to respond to complaints about long-term care facilities. So they are charged with answering resident complaints, families' complaints, investigating. They also do unannounced visits, and they do training. They do many, many things in order to further their goal of ensuring that residents in these long-term care facilities get the best quality care possible. And those of you who listen to my podcast are probably thinking, gee, I'm pretty sure I know that person. And that's because I had her on as a guest, I think last October. She was a guest on my podcast, episode 30. And if you want to learn a little bit more about the Ombudsman Services, you can listen to that episode. You can find it on our website, absolutetrustcounsel.com. And in that episode, we really go into a lot about what the Ombudsman Services does. It's a lot. They've got their fingers in all kinds of things in order to, further that goal. I'm not going to take the time to go into all of that today, because today we have a short period of time and we just want to focus on the particular issue at hand. But please feel free to go check that out. It's a very interesting episode. I know you'll get a lot out of it. So because of all the news we've been hearing about what's happening in long-term care facilities, I thought this would be a good time to have Nicole come back. I have a lot of clients in assisted living facilities, skilled nursing facilities. I have a lot of clients who have family members in those facilities, and I know there's a lot of worry, a lot of concern. We just don't know really what all is happening. So I thought it would be a good idea to have Nicole on and give us kind of the front row view of what's really happening. So Nicole, welcome. I'm so glad to have you here. And just to get started, I want to ask you about, I know that we've been hearing there are a lot of infections. There have even been deaths in some of the skilled nursing facilities in our county. And my understanding, what I hear, is that as a result of efforts to sort of control the virus in those facilities, currently visitors are not allowed. And so I wanted to know, really from you, what exactly the rules are, who can go in, who cannot, what's happening inside the facilities to promote social distancing. We social distance out here by staying 6 feet away from each other and wearing face masks and all that kind of thing. But what's happening inside the facilities, and also how is these rules, these guidelines or rules or whatever you want to call them, how are they impacting the ability of the Ombudsman's Office to do their job?
Yes, Kirsten, thanks so much for having me on to talk about this. I appreciate it. I think you've raised an important issue, which is, as you outlined currently, because of guidance from Center for Medicare and Medicaid Services and California Department of Social Services and the Administration on Community Living, is that we as visitors, ombudsman included, are not able to enter long-term care facilities. There is a small carve-out, which includes if a resident is at the end of their life. So if the resident is on hospice or is in the active stages of dying, the facility does need to accommodate ways for visitors to enter. That's going to look different than it has in the past. It will not be a large family gathering, but rather individual visitors. But as you said, generally speaking, we're not able to visit long-term care facilities. That doesn't mean that we can't connect with residents in long-term care. And I think that's a really important distinction to make, is that facilities have been directed to be creative with connections, to use things like FaceTime and Zoom and Google Hangouts and maybe good old-fashioned letters and families coming to windows to find ways to communicate with between residents and their families on the outside. So I want to be clear that it's just like you and I, right? Like social distancing doesn't mean lack of connection. It just means that right now, in order to protect residents and to preserve their lives, that we need to make some sacrifices now that will pay off in the future.
Nicole, what's actually happening inside the facilities in terms of social distancing?
Yeah, life looks different for them too. They are also practicing social distancing. They are also doing meals in their rooms rather than in sort of community settings. They're still doing activities, but rather than doing them as a big group, they're doing them individually and they're more personalized. So activity and living and engagement is still happening. It just is going to look different.
Okay, well, I touched earlier upon this issue of, unfortunately, we've been having a lot of infections, even some deaths in these facilities. And one of the things that I've been hearing may be a contributing factor to that is the fact that in many cases, well, in some cases, some of the staff who work in the facilities actually work in more than one facility. So they might do a shift in one facility and then drive across town to their other employer and do another shift there. And so they're kind of going back and forth between facilities, which to me, I'm not a doctor, but that sounds like probably not a good way to contain a virus, a disease caused by a virus. Is that true? Is that what's happening, and is that possibly a factor here?
Absolutely correct in that, these are hardworking Americans who are doing the best to care for our loved ones. And like in many places, especially the Bay Area, it is expensive to sustain life here. And so those caregivers may work in multiple settings. They may work a day shift one place and a swing shift another. And I think that really, based on what we know what happened in Seattle and Life Care facility, is that could pose undue risk for residents because so many of us may have COVID-19, but may be asymptomatic and not know that we have the illness. And so that when a caregiver goes from one facility to another, they may unwittingly bring that illness into the facility. And I think that's a really key thing, is that these kind of staff members, that they really are doing the hard and deliberate work that we all wish we could be helping with right now. And so that when they're in facilities, I really am advocating for a system where they be incentivized to work at a single facility and paid appropriately with either a crisis differential or overtime in order to meet the staffing needs. One of the concerns is we have so few caregivers to begin with. But in a time like this, caregivers also are homeschooling their children at home or taking care of their elderly parent, that workforce is already reduced. And so that's why there's a feeling like there should be a need for those folks to work at different facilities. And what I would say instead is have a single workforce working at one facility for an extended period of time, compensated fairly and appropriately, would help to mitigate this risk. And I think also would help to make family members feel better about the situation.
I'm sure that's true, but what, in your opinion, would that require? Are we talking about government subsidies, tax credits? What kind of programs would have to be in place in order for that to happen?
Yeah, so I actually would point to the California Elder Justice Coalition. They created a sign-on, including my organization. They sent it to the governor, which actually outlined 3 funding sources that already exist that could support this kind of short-term payroll increase. I also would say that many of these businesses are small businesses, like small nonprofits, and they are eligible for things like the SBA loans. But I think the biggest thing is that I think the states and the federal government need to take interest. CMS raised and altered the Medicare reimbursement rates, but that's a percentage of a skilled nursing facility's revenue. They should also be doing that for what's called Medicaid or Medi-Cal. And again, we also need to make sure that those facilities that are privately funded, like you said, assisted livings, are also part of that funding structure. Facilities are working very hard right now to meet the need. They don't always have enough of the PPE supplies that they need to keep their residents and their staff safe. They don't always have enough staff. And so I think we as community members that we know that this is a highly vulnerable population need to dedicate resources and time to these businesses.
I agree with you. What I want to ask you about, though, we've been talking kind of about skilled nursing facilities. At least that's what's been getting a lot of press. We've been reading about skilled nursing facilities. But are these same rules with the no visitors in and out and the kind of social distancing that happens inside the facility, are these same rules applied to assisted living facilities?
That does still apply because, again, it's still a very vulnerable population and facilities are doing their best to keep their facilities safe. And so it's the same. Again, they are, again, if it's an end of life issue, a family absolutely has the right for in-person visitation, but they should know it is not going to be a large family gathering. It's going to be one person in at a time. They're going to have to enter and exit through one door, and they need to be mindful that they are not bringing the illness into the facility. So as much as possible, they should be doing what you and I are doing, which is socially distancing, staying at home, and not venturing out.
Well, I think you can see that I'm trying. I'm doing my best to social distance. Nicole, can you tell us maybe about some of the things that your office is doing in order to facilitate that? I know you have, among other things, a tablet program. Tell us a little bit about that.
Absolutely. So because as ombudsman, we are still not able to enter facilities, but that doesn't mean that our work isn't happening remotely. And we're trying to reach residents individually. And so one of the things we're asking the public to do is participate in the tablet turnover. So if you have a tablet that you're not using anymore, if you are you ready to reset that, you're getting something new, go ahead and return that to factory settings and contact us. And we'll take that tablet and we will give it to residents in long-term care so they can communicate with us and their family. Now, some of us may not have a tablet that we're ready to donate, but we might have $50 and they can donate that to our organization. It's Ombudsman Services of Contra Costa. There's a link on our website. They can go there and they can donate $50 and that will allow us to buy a tablet and provide that to a facility. And again, that makes life easier for facilities, for residents, for ombudsmen, and for family members. I know that I am doing sort of family dinners with my parents, virtually. And I think that being able to see them is such a relief. Even they live in their home. It's such a relief to be able to see them. And I think that's the same thing is true of residents. I think one thing that's great about this time is I just read an article about how older adults are using technology. I think we maybe had this idea that, older adults, they don't want to use technology. They don't know how to make the camera work. Turns out they really can, and we need to encourage them. That stimulates the brain, that it provides engagement, and that really helps to lighten the load during this crazy time so that they're less anxious, so that they can have some peace of mind and a little bit of fun.
I totally agree with you on that. I have for a long time resisted the idea of incorporating some of this technology into my practice out of fear that my older clients wouldn't appreciate it. And I do like face-to-face conversations, but I'm really finding, and it's surprising to me, that my clients across the board, old and young, are completely comfortable. They're willing to try it. And some of my older clients are way ahead of me. They're suggesting, I'll just FaceTime you. They're used to FaceTiming with their grandchildren, so it's not a big deal to them. And I'm really enjoying it, and it keeps us moving along. And also, I just want to say, I think your program is such a brilliant idea that tablets and laptops might not be things that folks in skilled nursing facilities necessarily have with them. And I just think it's such a great idea that you have this program to provide that to those folks.
Oh, thank you. I got it from fellow ombudsman. I can't take credit from that, but happy to bring it to our community.
Well, but you took it and you ran with it, so you deserve some credit as well. Nicole, we've been talking about some of these new procedures and limitations, restrictions that we've got in place in the facilities, the no visitors, the staff working only in one facility, not multiple facilities that we're trying to accomplish. Do you see these things as protocols that we really ought to implement going forward on a permanent basis as opposed to in response to a crisis?
Yeah, so I really believe that residents have the right to visit with whomever they want to and leave the facility and really have a robust life, as you and I do. It's just that you live in a long-term care facility. But I think that right now it's time to be cautious. And so I think to myself, as you know, the governor and the president might lift restrictions on us. I'm not going to run to the movie theater. I will run to the nail salon, but I'm not going to run to the movie theater. And I think that that may be sort of a tiered approach with long-term care, is that while the restrictions will be lifted in sort of gradients, and so they may return first to group activities in the facility or shared meals, and then sort of limited visitors. Like this might roll out over a period of time. And I think it's important that we're vigilant and that we hold our licensing bodies accountable to make sure that they are working towards an end. And right now, I think it's really important that we pause and find other ways to engage with those older adults in our lives and facilities, and give them the space that they need to be safe and well.
Yeah, Zoom is a really fantastic tool for doing that. And there are lots of other tools, but that happens to be one of the ones that we've been using in our office. And yeah, I agree. It's important to stay connected for all of us, and especially for people who are particularly more vulnerable and more isolated. Now, I want to ask you, Nicole, we're going to have some questions here. We've actually got quite a few questions, so I want to leave time for that. But I do want to give you a chance to help us understand what we can do. For those of you who aren't aware, the Ombudsman's Office is not a government entity. It is a nonprofit organization. And like all nonprofit organizations, they depend on volunteers, on donations, on grants. And so, Nicole, tell us what we in the public who care about this issue can do to help out.
Yeah, so first of all, we have a resource on our website. It's on the front page. It's called COVID-19 Updates. And so if you're wanting more information about these regulations that are ever changing, or you're wanting to see some resources we have, you can always go there, and we update it continually. So that's the first thing I would want to say. In terms of our organization, some of the things we're looking for, again, those tablets. We're also going to be launching a friendly visiting program in Solano County in a few months. And we are looking for volunteers who are going to be willing to pick up the phone and call seniors. And then when able, who are going to be able to go visit those individuals who are homebound or bound to facilities. And I think this is a great time. People are volunteering. I hope that they're considering in their lives how they can maintain that volunteerism when we do to return to our new normal. And so we're looking for volunteers who are interested in becoming long-term care ombudsmen. We're also looking for people who want to participate in our friendly visiting and telephone reassurance program. But if you're just not quite sure how you fit in and you're like, but I want to do something, go to our website, look around, contact us, and we'll talk to you, because my guess is you have a skill or trait or something you have to offer to older adults.
I really like that idea of the friendly visiting telephone reassurance program. First of all, I like the name of it, but it's very sweet, the idea of maybe you could become somebody's virtual grandchild and just check in and sort of, lift each other up. That's very sweet. Okay, so Nicole, we do have questions, and the questions are for you, not for me. So thank you for sticking around and answering questions. Our first one, are family members allowed to take their loved ones home from these facilities on a temporary basis in order to protect them from the virus? And is that even a good idea?
So that is a great question. And so I think that the answer is, first of all, it's not a one size fit all. It's a series of questions to consider. So the first thing I would consider is someone went to a long-term care facility because they had a need that wasn't able to be met at home. And so I would ask the family to consider is, one, can you meet those care needs that they have now or that they might develop over time? And it's something to consider. We wear the mask, to protect me from you and you from me. Consider that maybe in a home setting where you have to leave to go grocery shopping or maybe run an errand or two, that may not be as secure a place as a long-term care setting. So consider that. Also, in terms of a skilled nursing facility, it is very important that you consider the funding source. So we have not yet heard from Center for Medicare and Medicaid Services if a resident leaves that facility to go to home, if they will be permitted to return to that facility. In other settings, like if they go to a hospital, if they go on a trip, there are certain definitions of when that bed is held for them. We have not yet heard that that will be the case. And I don't want families to end up in a situation where they can't meet their loved one's needs, and then they might end up in a facility far from them. So I think at this point, I understand it's a personal decision to make. And I want you to be thoughtful and intentional about that, operating from knowledge, not fear.
Well, that's a very good point. Don't panic. Don't make this decision without thinking it through, because it has consequences that you might not have even thought about.
If you're feeling fearful, that's a good time to call the ombudsman office and say, okay, I've got mom in a facility. I'm starting to freak out. Tell me, how should I approach this? Is she safe, or can I still communicate with her? I think that's the path to take. Don't just make a drastic action.
Well, and it's good to know that you're there for that, along with all the many other things that your office does. Okay, my next question is from Taylor. Thank you, Taylor, for your question. Are local governments aware of this issue with staff? And I think we're talking about that issue of the staff in many cases has to work in multiple facilities, have multiple jobs in order to, stitch together a living.
Yeah, I think that long-term care, unfortunately, has been a sort of part of society that many people don't always understand the spectrum and the different segments of the population. And I think that government officials are getting a really crash course in what I live in every day. And so I think the key is that you're becoming aware of it, but that we need to be the ones to tell them. And so the one thing I would say is on our Facebook page for Ombudsman Services is we have an image that says, I stand with CEJC, the California Elder Justice Coalition. And I encourage people to share that image and tag the governor in it and their elected officials saying, hey, I care about the lives of older adults in long-term care, and I care about caregivers. And I think that's a way that they can help get the message out. So I think their government officials are becoming more aware to this industry, and I hope that we can help raise it even more.
I hope so too. Okay, my next question is from Kendra. Thank you, Kendra, for your question, and thank you for joining us. Kendra's question is, who will train the residents to use the tablets once you've provided them?
Yeah, that's a good point. And I would say right now in facilities, it is staff. And so I think, I'm thinking of what my grandmother is like. She really loves cell phones. She maybe didn't run it herself, but we could help set her up. And so the staff can help the resident get set up on a tablet or phone or computer, and then give them the privacy to talk to their family members alone. So there is an increased responsibility on staff. And I think that's another example of why they should be paid appropriately, because between uses of that, they need to disinfect that device to make sure it's safe before it goes to the next resident. But I think it's a exercise we all need to be doing.
My next question is from Sandy, and Sandy says, my 85-year-old mom and her friends have been using Zoom to do their book club. And I think that Zoom and these kinds of tablet programs are just such a valuable resource for the community. And okay, so that's not really a question, that's a comment, and I totally agree with that.
Okay, next question. How
with the book club online also via Zoom.
Yeah, Zoom is a fabulous tool. I'm going to have my book group next week on Zoom. We'll see how that goes. First time for that. how can people be sure that nursing homes are following the rules, the having staff wear masks, giving masks to the residents, keeping residents apart? How can we know what's really going on inside? And it seems as though probably the answer is we really can't.
I can't guarantee you that we know that, because I can't send my staff in to check the situation. What I would say is, if I had a family member in a facility, is I would be having some really direct daily or weekly conversations with facility administrations and directors of nursing. And I would be asking specifically about their supply of PPE, when their staff are donning and doffing that, and how it's being used to care for my family member. Again, this time calls for more information, not less. So if I can't guarantee you, and if you have a direct concern, you should raise that with Ombudsman or Department of Public Health or Community Care Licensing. But I would take it up directly with facility administration and let them know that you want to know how this is being used.
Well, that's kind of related to my next question, which is from Stephanie. And Stephanie says, we know many facilities are overwhelmed right now, and updating family members and responding to family member inquiries might be falling to the bottom of their list. What suggestions do you have for families who want to get information but don't want to be even more of a burden on the facilities?
Yeah. So I think it's a combination of things. That simply is a responsibility of the facilities, whether it's in COVID-19 times or not. So the facility needs to have systems in place to how to respond to that. That being said, if I were a family member, I would ask, what is the best way to reach the facility and whom should I be reaching out to? So potentially they could designate a staff member, like, who can I talk to on a daily basis about what's going on? Don't want to add stress, but tell me who I can reach out to. Because some staff aren't doing the same kind of work anymore and they've been diverted. And so some facilities have designated other people to do certain skills and they might have time for that. So I would just be asking, who can I speak with? And again, if you're getting pushback on that, understand the facility does have strains on them, but be clear that you want to hear what's going on. And I think it's a little bit of spoonful of sugar, is like direct and sincere questions, not raised voices, are going to get you answers.
Yes, and that's true in all aspects of life, right? Nicole, we're just about out of time, but before I let you go, first of all, I want to say thank you so much for being here today. I really enjoyed the conversation, and I'm sure our listeners did too. Before I let you go, is there anything else that you want our listeners to know?
Yeah. Well, again, thank you for having me. I think what's important for listeners to know is that while this time looks different, we still need to be dedicating time and resources to family members. So please, engage with them. But also, if you're a caregiver at home, set boundaries for your own life. I know that the fear can really raise, and this is an uncertain time. Make sure that you're taking care of yourself, because this is a marathon, not a sprint. And your family member needs to be taken care of, and you have to take care of yourself, because when this is all over, we want you to be well so you can go back into the facility to see them and they can come back home for family dinner.
Again, good advice. You got to take care of yourself, right? Put your oxygen mask on first before you help somebody else with their oxygen mask. Thank you, Nicole. Again, I just really, really appreciate you being here, and I want to wish you all the success in the world in the many, many projects that you've got going.
Excellent. Thank you, Kirsten. I appreciate it.
And thank you to you, my viewers. I guess I have to call you viewers. You're not listeners. For joining us. I'm going to be here again next Thursday, live on Facebook at 11:30 Pacific. So I hope to see you then. The last thing I want to mention is just a reminder about our coronavirus estate planning special that we are running through May 3rd. And we are offering comprehensive estate plans for most people. Most families would qualify for this particular package that we've put together. For a single people, $2,500. For a married couple, $2,950. That's a trust, will, power of attorney, healthcare directive. We figured out a way to do this in a package that I think will work for most people, and we're just really trying to encourage people to focus on this very important aspect of their lives, very important for all of us. Right now, it feels maybe a little more urgent. So check us out on our website, absolutetrustcounsel.com. You can call us 925-943-2740. You can schedule a discovery call right on our website. There's a calendaring function there. So any way you get to us, we're happy to talk to you. We are open for business. Our doors are not open, but we are working remotely and we're getting it done. Thanks again for joining me today.